The beaches are beautiful, the weather gorgeous, the airports are packed, and possibilities for travel endless. There are not many places in the world unexplored. But the modern traveler should be wary, especially when tiny travelers are involved.
More and more families will travel with their children internationally. And when doing so, parents should be well informed of the potential infections that are in other countries, the immunizations that are necessary before they go, and very simple precautions in preventing infections while the family, including children, are traveling.
Jeff Samuels and his wife, Anna Lucia, have 2 young girls. They still manage to travel outside the country, sometimes twice a year.
Before we travel abroad, we like to talk to the pediatrician, and we ask them, we'll try to ask them as many questions as we can about what particular illnesses the country may have and if our children need some extra shots. And it's just really important for us to play it safe. We don't want our kids exposed to anything.
A growing number of families like the Samuels are looking for more than just the basics of health care. Children's Hospital Boston has recognized the growing need for travel preparations. It's created the Travel and Geographic Medicine Clinic in its hospital emergency department. Here, specialists trained in infectious diseases, tropical illnesses, and tropical medicine are on hand to answer questions, provide specialized immunizations, and treat rare illnesses if needed. The focus is on prevention.
A major goal of prevention is to make sure that children who are living safe in this country do not go to a foreign country and acquire an illness which does not exist in our country but is very prevalent in the foreign country that they're traveling to.
Travel through certain areas of the world could expose a child to yellow fever, typhoid fever, malaria, hepatitis A, cholera, diphtheria. They're among the many infectious diseases common in many parts of the world. The foods in many parts of the world can also pose a problem.
Toddlers and teenagers tend to be the ones that get diarrhea when they travel because they eat indiscriminately.
A simple rule for parents: if it hasn't been cooked, boiled, or peeled, don't eat it. Usually bottled water is your best bet. And when it comes to preparing a child or an adult for an exotic getaway, plan ahead.
In general, most immunizations will start taking effect 2 weeks after they've been given, and therefore, given that some immunizations require series, it is most safe to start getting these immunizations 4 to 6 weeks before travel.
The bottom line is, be prepared. Talk to your pediatrician or travel medicine practitioner. Ask questions about your destination. Some countries require proof of immunization for certain illnesses, so get information in advance and have a plan of action in case of emergency during your trip.